Today, I'm going to educate you about a ceremony called as the Palkhi ceremony carried out in the Konkan areas of Maharashtra. In this ceremony, a heavy palki is carried by two gentlemen and then rotated at very high speeds. This can weight more than 100 kgs. During this ceremony, elderly gentlemen are likely to put more stress on their spines in terms of increased axial loading. Hello everyone, I'm Dr. Aditya Raj, an Orthopedic Spine Surgeon at Synapse Spine. Earlier this week, I encountered a gentleman presenting with an osteoporotic compression fracture in his lumbar spine. This fracture was not due to routine trauma from fall. This fracture was due to a heavy palki that can weight more than 100 kgs. This 78-year-old gentleman who presented to us with back pain that was not improving with any kind of medications. He had pain even on turning in bed and getting up from the bed. Once we got his x-rays, we found out that he had a compression fracture in his L2 vertebra. On MRI, we found out that this fracture had gone into non-union and hence required an intervention from our side. We counsel this gentleman to undergo something called as a vertebral augmentation procedure, or in simple words, a vertebroplasty. After this procedure, the gentleman was pain-free in the next few hours itself. He was able to get up from bed, walk independently, and was discharged the same evening. This tells us about the importance of diagnosing these fractures at an early stage. Once they are diagnosed at an earlier stage, the likelihood of them requiring a surgical intervention where we have to put screws becomes less. Most of these osteoporotic fractures can be managed with vertebroplasty alone. If you are someone who has been diagnosed with an osteoporotic compression fracture in their spine, make sure you visit an expert regarding the possibility of this procedure.